Hello and welcome to The Public Good. This is Deja James from Partnership for the Public Good, or PPG, which unites over 365 community organizations working to build a better Buffalo. We're delighted to join you every Tuesday morning at 10:30 a.m. on Power 96.5 FM and Mix 1080 a.m. You can also watch full video of every show on our YouTube page. Follow PPG Buffalo on Facebook and Instagram for more information on how to access video and the full podcast of our show. And of course, you can always find great information on our website, ppgbuffalo.org. All right, our weekly spiel is over. We are joined today by Erie Niagara Area Health Education Center, or AHEC, they've told me for short. So we probably are going to keep saying AHEC because that's pretty long. But by Kaila and Madeline, we're so excited to have you here today because we're going to talk about something that I think has been, very present in pop culture news and just health news, which is maternity and female maternity and health for expecting mothers and mothers who have already had babies as well. So I'm really excited to have you both here today. I want to give you both the opportunity just to introduce yourselves, what your title is, some of the work that you do, and maybe even where you're from, if you're from the area or not, or anything like that. But I'll turn it over to you all.
So I'm Kaila. I am one of the program specialists for the Birth Equity Project at AHEC, and I will turn it over to my colleague.
And I'm Madeline Ackley. I'm the other program specialist for the Birth Equity Project at Erie Niagara AHEC. I grew up in Western New York, but not even close to Buffalo. I grew up down in the southern tier in Gowanda, New York, actually.
Yeah.
Yep. And I went to college in Pennsylvania. Then I came back here for my master's degree, and now I live in Buffalo. But yeah, we're the two. I call Kaila my business partner. We're the two that are responsible for the Birth Equity Project at AHEC. So what that entails and the mission of it is to reduce Black and Brown infant and maternal morbidity and mortality rates of moms here in Erie and Niagara counties.
Yeah. And how long ago did this program start? Because I've seen, I think, peripheral, because you guys have actually a lot of programs that you do out of this office. And I think I've seen individual kind of actors from the different programs you have, but I didn't know about the entirety of AHEC and like what you all do. So I'm just wondering like when you all started doing services and things like that in the area. Maybe you always did and we just kind of didn't know about it, but just wondering if the audience wonders about it too.
Yeah. AHEC has been around for 20 years, Erie Niagara AHEC.
Yeah.
We just had our 20th anniversary and gala actually in August.
Exciting.
But a lot of the work that Erie Niagara AHEC has done in the past has been with high school and collegiate pipeline. So increasing the students that go into healthcare professions. So a lot of programs that we run besides Kaila and my program are programs like Patch, which is where teens from various high schools get trained on how to be teen educators for their peers, as well as other healthcare providers. And then we also have other programs aimed towards collegiate students that includes AHEC Scholars, which just kind of recruits a bunch of interdisciplinary students in the medical field, dental field, social work field. And they kind of all work together within their cohorts to go through different modules and such.
That's amazing. And so with the teens, is it kind of a pipeline for them to go into health or like into that field, or is it really for them to have like health awareness now for their communities, or both?
I would say it's both.
Okay, that's awesome. Yeah.
But the aim is for them to go into healthcare.
That's awesome. No, that's really great. I think there's a couple of different like career pathway programs for young people, but I definitely think that a lot of them focus on trades, plumbing or factory work or manufacturing and things like that. And I don't think we talk enough about how to get into the healthcare field and all the different roles that there are in the healthcare field. Because you don't have to just be a doctor to work in a medical setting. And you don't just have to be like a CNA either, which I think is what either people think doctor or CNA, but there's a lot of different things in between, like technical positions or other thing like that, where you only really need training. You don't even have to have like necessarily formal long-term higher education or things like that. And they pay very well, which is really important to know for a lot of communities here in Buffalo, especially we have such a big medical sector. So that's awesome. But I'm wondering more about your maternal health program, because I read in some of the materials that you all sent me that you actually even have like a doula partnering program with mothers and different things like that. So in what ways are you supporting mothers locally so that they have healthier pregnancies? What type of programs do you do out of your office?
I'll let Kaila start with talking about doulas because they're kind of centered around our program.
Yeah.
And Kaila is kind of the go-to gal for our doulas and our doulas trainings. Yeah. So I'll start with that and then get going about the moms.
Get close.
Okay.
Yeah.
So our program started September of last year. The Birth Equity Project started. And what we do is recruit women from the community to train as doulas, because who better to serve the moms in the community than those from their community?
Right.
So we recruit people that want to serve as doulas, to serve Black and brown moms that are Medicaid-eligible.
Okay.
So we take them through a 3-day doula training where they get all the basics, and then throughout like a 3-month process, they go through supplemental trainings that make them eligible to become Medicaid providers. Mm-hmm. And then we go through that application process with them, and they're able to then bill Medicaid for their doula services with the moms. And I'll let Madeline explain a little more on the mom side.
Yeah, so then the moms who come to us in our program, they are Black or brown race. They're before 28 weeks just because we want to have some time before that baby comes for them to work with their doula. And as of right now, they have to be a resident of Erie County and be eligible for Medicaid. And we're hoping to expand that soon. But moms that come into our program, they are paired with one of our doulas, and they meet with that doula one-on-one for any prenatal planning, whether that's birth planning, whether they're going over comfort measures, whether they're going over what should I pack in my hospital bag, whether they're taking a tour of the birthing center if they want to do that route with their doula. Whatever they decide is best and whatever they feel comfortable with, they kind of work with their doula for that. And then that doula is there for them during labor and delivery and then also postpartum. So when that mom comes home with that family and that newborn, kind of going over care for herself, care for the baby, feeding and all of that stuff. But that's what the doula will do with them. And we connect them to a doula. And then we also, Kaila and I also are trained community health workers. So we do weekly check-ins with the moms. And that is just kind of going over how is everything going? Is there anything that we can help with? Whether that be, can we send you a monthly bus pass because you're having transportation issues? Right. Because we know that's a really big barrier of care. And it's probably one of the biggest barriers of care we've seen since we started our work. So if there's transportation, if there's a housing referral that we can fill out for you, whatever that may be. Yeah. And we do check-ins with them once a week. And then also every month we have classes for the moms. So this upcoming month, we have a class with SNAP Eds coming in. Mm-hmm. And then we also have one of our doulas actually who really is into that postpartum world. She's doing a postpartum 101 class for the moms. Mm-hmm. So every month they have 2 classes. And again, they range in topics. And then for their participation in our project, they receive monthly stipends, which are gift cards.
That's amazing.
Yeah. And then we're with them until their infant turns 1.
That's awesome. And nobody really talks about that postpartum support that moms usually need, where it's really, really, they're susceptible to having postpartum depression for a lot of different reasons. I mean, your life changes. Even if you already have children, it can just be that extra stressor. You know what I'm saying?
Absolutely.
So, but I want to rewind it a little bit because I'm realizing that not everyone may understand what a doula is. Mm-hmm. So, and to me, what a doula is not just support for baby and mom for baby, but mom for mom, right? Mm-hmm. Like all that kind of wraparound service support. But I'm wondering if, in both of your professional opinion, like what is a doula versus just your regular GYN type of experience?
Yeah. So a doula is a emotional support person, emotional, physical. They kind of fill in the gaps of the provider, whereas you're only seeing your provider, maybe you're going once a month. By the time you get there, you might forget the questions that you have. Mm-hmm. The doula is someone that you can call. They can help you in between time. Mm-hmm. We find a lot of times that the moms are more comfortable with the doulas. Mm-hmm. Sometimes they actually have them accompany them to their prenatal appointments just to help them advocate for themselves. They give them the encouragement to speak up for themselves and ask their questions. The doula is telling you, like, okay, make sure you write this down. Make sure you ask about this. Okay, well, make sure you ask why you have to do this. If you're not comfortable with that, make sure you say something. So they're just advocating and helping the moms advocate for themselves,
Right.
And providing that support. And they're there all the time. They're there around the clock. You can call your doula anytime. Whereas you might have to wait for the provider. The doula is just more accessible.
And to be clear, doulas don't necessarily, they're not the ones like helping you give birth. You still have your...
They are not medical providers at all.
Yeah.
They do not catch babies.
Yeah.
They are just there to support you.
Yeah. No, wonderful. I just want to clarify for listeners so that they understand really the benefits of a doula, because really, like you said, they are that extra support for you. I think navigating the healthcare system with anything, not let alone not just pregnancy, like everyone probably needs some type of support system to, one, like you said, advocate for yourself, to understand, or really even try and come up with the questions to understand why you're getting certain treatments, or that there may be other treatment options. I think a lot of the times too, people go to the doctor tells them, well, you need to do this, or we're going to have to do a C-section because your baby's in this, whatever. And then not knowing, well, I can actually push back against that or ask why, or maybe there's a different procedure that they're not presenting me the options for. And so I think that's amazing, and everybody has their own experience. And we've seen like major stories like Serena Williams, for example, I think is the biggest one lately, where she had to advocate for herself. And if she had not done that, who knows what would have happened to her and baby, right? And so having that support system there through a doula, I think is really great, especially for Black and brown women who we know don't necessarily get the attention they deserve in medical care settings. And who may not have the propensity to advocate for themselves in a certain type of way in those settings because maybe they don't have the confidence, they don't feel they don't have the knowledge or whatever. So I think that's awesome. I want to dive a little deeper also into the year after, having the baby, that you guys are supporting moms. I'm wondering, like, you said it was for Medicaid specific moms and you want to expand that. But just wondering how much you've seen in your personal working with the moms, the impact that has had with moms that you've been working with. Like, how much of a difference, in your opinion, has it made in the care and support of these moms, and why is this program kind of so important for community members?
I think one of the major things with our program specifically is all of our events we have in person. So all of our classes we have in person. And just seeing the moms being able to create that community amongst each other is one of the best things about the program. Because whenever they come in, they're like, oh my gosh, I haven't seen you. Your baby looks so much bigger. And it's just really, it makes me always happy when they come and they're able to talk amongst each other and create that kind of network, because they're all going through the same thing, whether they might be having their baby in a few months and they're talking to someone who just had their baby, but they're able to connect kind of on that personal level because it's something very intimate and personal that I think that's really beneficial to have those moms all kind of create that community within each other.
And the community is so important because I think even as, like me, a woman myself, I feel like my mom's told me a little bit about her birth story. You know how your mom brings up, like, your head was this big and whatever, I did this or that for you. But beyond that experience, you really, like, nobody's preparing you as a woman to have a pregnancy if that's the way you want to go. I don't think we talk to each other enough about that experience because there's so many people who have gone through it before. And I find most women who are pregnant feel like they're the first women ever experiencing pregnancy. They feel so isolated in that experience. You just don't know anything about it. You don't know what resources are available. You don't know how it's supposed to go, what other people's experience has been. So I think, like you said, that community building piece is just so essential. But I'm wondering what your opinions are too about, being a woman, and how prepared do you even feel for pregnancy, and how much we kind of don't have that community type of support as women in terms of pregnancy. How do you feel about that?
Just to go off of what Madeline said, I think that's the part that I love, especially when it's new moms, like first-time moms, and they come and they're like, oh, my due date is in 2 months, and I'm so nervous, and I don't know, And then they can have that network of moms to say like, oh, well, you know, where are you delivering? Okay, I went here and this is what happened. And I went there. Who's your doctor? So they kind of get like a personal experience, and they can kind of know what to expect from a mom point of view. And then you know that you have your doula there to support you. So they're like, oh, and then when this happened, my doula said this and my doula did that. And it just gives them like more insight and more comfortability, I feel like, going into it. For me, I don't have kids yet, but I do know when I do, I already have my doula.
Yeah.
Like,
Yeah.
Shannon Johns, I know you're out here listening. And
Shout out.
or Shannon, her like, listen, Shannon, like I will literally give birth within your schedule. Like, just put me in your books and let me know where you're free, because I have to have Shannon as my doula. So, how do you feel, Madeline?
Yeah, and I also feel like I've got my bachelor's and master's degree. I got my bachelor's degree in biology, so like science, right? But me and Kaila have sat through doula training twice now, and there were things, and I was just like, I didn't even know that's what happened. Like, that was a choice. I had no idea they did that. And there are a lot of things that are kind of just built into policies and hospital policies that are just kind of automatic.
Yeah.
And if you don't say something like, hey, what is that? Or what's happening? Or is that something that we have to do? Can we wait on that? There's things that just are automatic that now I think I'm much more aware of. And I think it is unfortunate that those things aren't made a little bit more publicly aware, especially for vulnerable women in this state. But yeah, I would say I was 0% prepared. And again, no children, but I'm really happy that I was able to at least have going through doula education and learning a little bit more about the process and options that are available, and ways that you can kind of speak up for yourself and be like, I'm not sure if I want to do this right now. Is this something that we can wait off on and do at a different time?
Yeah. No, I'm always surprised by that too. The kind of lack of, I mean, it just doesn't seem like there are options when you go into medical care settings. It seems like I'm just supposed to go in here, they do the treatment, I'm supposed to just do whatever they say. And it could or couldn't be, good for you. I mean, I think what people kind of misunderstand about the medical profession is that it's a little bit trial and error, a little bit. I mean, each person is individual, and their own kind of genes and all of the things that are going on with their body work differently. So different treatments will affect different people differently. And obviously we have science, we have medicine for a reason, and there are tried and true things that do help things like diabetes or different things like that, or you definitely should take your prenatal vitamins or different things that should happen because that is part of the general health for yourself and baby. But there are options, and I don't think our medical care system is set up to be understood in that way. And I find just as I'm learning about things, once again, I also don't have children, so I'm not necessarily talking about children. It's funny, we're all childless talking about this, but it's fine. Because I do think these are conversations that should happen before you go into pregnancy, which is the other thing. I mean, I think it's wonderful that you are supporting like first-time moms, and there is that support for, you find yourself pregnant now, what do I do? Like, who is here to help me? And maybe you don't have family members to look up to or that have gone through this to be able to talk to. So this is a great resource for people who don't have that community, or even if they do, maybe they also were misinformed or don't have the knowledge about all of the options and different things that are available. Because I know when my mom says, she had in the 90s, and the 90s healthcare is way different than modern day healthcare, which is the other thing too. So if you do have a mentor kind of in your family, they're also working on kind of a dated understanding of what currently is available or how they do things too, even though I've heard that it hasn't advanced too much in terms of women's healthcare.
It's gotten worse, actually.
Yeah. So that's the other, which is why we need to be able to advocate for ourselves and understand what the heck is going on. But you go into it really not knowing anything at all. You're just really like relying on your GYN to like walk you through the process, when that's not the approach they take. That is the doula who like has that external knowledge of this is what you should expect when you go. This should be your 2-month thing, versus they're just kind of measuring your belly, looking in there, doing the heartbeat, and then sending you on your way, right? So I'm really glad that you guys are that extra support. I'm sorry, my brain kind of went on a tangent here a little bit. But I'm also wondering for your doulas that you're recruiting to become doulas, like how do you go about that recruitment process? If people are interested right now in becoming a doula, how would they get in touch with you? How do they participate in your program? How do you do that outreach for the doula process?
So usually we do a lot of social media outreach. We'll have flyers, and then we have on our website the application that you can go to and fill out. It is like a rolling application, so you can put your application in anytime, and then when the next training is scheduled, we'll send out the information for that. So if you did want to apply to be a doula, it's Erie Niagara AHEC.org. Okay. So that application is always open. And then once we do set a date, we'll just send out the information. And if you can participate, you just let us know. And then we set up an interview. And we have like a quick 20, 30-minute interview, just going over all the requirements and getting your interest and making sure that you're actually passionate. Doula work is not for you to get rich. So you like to make sure that you actually have a heart for it, because I think a lot of people, they hear like be a doula and it sounds good until you start going through the process of actually becoming a doula. And when you're getting a call at 3:00 in the morning that, oh, this client has went into labor, like it's different.
Yeah.
You know? So you have to be ready for that.
It gets real.
Yeah.
Yeah.
Especially during the shadow process, because they won't wait for you. They're not gonna wait for you.
Yeah.
So they have their main doula there. If you're shadowing, you miss the opportunity.
I mean, they can't wait for you. Especially, I mean, literally cannot wait.
It won't happen.
Yeah.
You just missed your opportunity. And I think sometimes people, they like, I don't know what the ideology is, but they're like, oh, this is sounding good and I can help the community. But to actually do it,
they don't understand really the commitment it is.
Yes.
Yeah.
Yes.
Right. So beyond the kind of odd hours and different things like that, you talked about some of the other requirements specifically for your program. So what type of requirements are those? I mean, is it just kind of the time commitment of the training? Like, what other requirements are there? I'm also wondering, the moms you help have to be Medicaid eligible. Is there kind of an income guideline for the training program you have for doulas as well? Is there a kind of requirement for them, or who can become a doula through your program?
So it's very loose requirements for the doulas. You literally have to just have like a flexible schedule, be able to commit to the trainings and the supplemental trainings. And, we understand that people have full-time jobs, so we try to be flexible and work around what you have going on. If you can't make it to a training, if it's online, we'll sometimes be able to record it and let you make that up. So we try to work with them. I think the most taxing thing is the shadowing component, because you have to shadow 2 prenatals, 3 births, and 2 postpartums with an experienced doula before you can.
And what's the time period of that? Like, obviously the births are the births, like that happens in whatever time period, but like postpartum, how long of a time period is that shadow, or whatever?
So they do 4 prenatals, the birth, and then 4 postpartums per client. The postpartums happen within a 6-week period after your birth.
Okay.
So it just depends on, the due dates and what's available.
Yeah.
But we have our class now going through their shadowing. They're doing really good. I think everybody should be done by March, and they trained in June. So
from June to March, so a little under a year.
Yeah.
Yeah, not too bad.
Yeah, and that's just because of how, the moms' due dates are lined up.
Okay.
It just depends on when they're due and what the capacity is of the doulas.
No, that's awesome. So in a little under a year, you could, and then what, this certification, is it like through New York State? Like what is a doula license? I guess I'm not really sure about that process. Yeah.
So there's not a specific doula license.
Okay.
We take you through the Medicaid process so you can bill through Medicaid.
Okay.
But you can do a doula training and then you doula. Like you don't have to actually.
But this is so you can actually be serving moms that are being served through the Medicare system. Because there's a lot of requirements to be a Medicaid provider.
Yes.
So they really put you through it.
So that's the process we go through. But there's other options out there.
No, that's awesome. Yeah. So you're essentially helping people make their own business, though. It's like setting them up to be this entrepreneur that's also, like you said, serving community, which sounds great, but there is a commitment to that.
Mm-hmm. Yeah. And I would say a lot of the doulas that we work with that are experienced doulas, they take on a mixture of Medicaid eligible, and they also take on private pay clients.
Yeah.
Because of right now, you can get a doula either through private pay or Medicaid. There's not really any insurance companies that cover that service.
Okay.
We're hoping to advocate for that soon so that everyone can have that covered under their insurance, because there's definitely is a gap of care where you might not be eligible for Medicaid, but then you might not be able to afford a doula out of pocket. So there definitely is a gap of coverage in there that hopefully could kind of be solved or mitigated with allowing insurance companies to bill for that and cover for that.
Well, see, that's my side of things because I work on policy. And so that's really interesting to me that a government-mandated kind of healthcare system recognizes the importance and need for doulas and therefore covers that cost. But private insurance companies don't see the value in that and aren't covering that cost. That's really...
We're hoping to get that changed soon because Medicaid has covered Erie County residents because of a pilot project.
Okay.
So Erie County was one of two counties, Erie County and Kings County, downstate.
Okay.
And Erie County picked up the pilot project. Unfortunately, Kings County wasn't able to pick it up just because of the low reimbursement rate for doulas and the higher living wages down there.
Right.
And so Erie County picked it up, and since it was so successful, it now, coming January 1, will be implemented throughout the entire state. So we're hoping, And so the goal is to kind of show what a great asset that is for pregnant individuals, and that can be shown to other insurance organizations for them to allow that coverage in their benefits.
And be exemplary to other states, because I don't know if there are any other states.
Yeah, there are a couple,
But this is, that's awesome. I didn't know this was a pilot program. So that's even more impactful because now you've made Erie County and Buffalo specifically the model for holistic care for mothers. And that's just amazing. I'm so inspired by both of you and your work. We're already at the end of the show, which is amazing. But I thank you so much both for being here and talking about such an important topic. I really hope our listeners, one, take advantage of the doula program. If you Medicaid qualified, go ahead and get in touch with AHEC so that you can get some services. And then if you're interested or want to learn more about being a doula, definitely get in touch with them as well. Or if you have family or friends or anybody, because we do need more care in the community, and the more doulas, I assume, the better. So,
absolutely.
I think this is wonderful. Thank you both so much for coming. This is Deja James with Partnership for the Public Good, or PPG, and we convene 365 organizations to create a better Buffalo. Join us every Tuesday morning, 10:30 a.m. on 96.5 FM or 10:30 a.m. Thank you so much.